So if you think about all these different levels, clinical interventions are less impactful.
What?
With children in schools, if they don't have a full tummy, it's a lot harder to learn.
Plumbing, I mean, that makes a big difference.
Our lifespan's increased by 30 years. And everybody's like panicking. Like, yeah, let's take care of this problem, this people in the river. And eventually somebody goes, why are there so many people falling in the river?
Welcome to Everyday Epidemics, where we dive into all things public health, from tobacco and preventable disease to infections and much more. Today, we're thrilled to be joined by Kendra Murray, a dedicated public health detailer for Douglas Public Health Network. Kendra brings an incredible range of skills to her work, including health promotion, motivational interviewing, outreach, continuing education, and keeping our local providers updated on emerging public health trends. Recently, she played a key role in our local health disparities assessment, and that's really just the tip of the iceberg. On top of all that, Kendra is a mom and one of my closest colleagues. I feel incredibly fortunate to know her, and our Douglas County community is equally fortunate to have her in public health. Welcome to the podcast, Kendra.
Thanks. Happy to be here today.
So before we kind of dive into your expertise and all of the incredible work that you do, talk about the broader role of public health. It's something that touches every aspect of our lives, yet often operates kind of maybe behind the scenes. So how do you see public health contributing to the well-being and the lifespan of our community members?
Ooh, that's a good question. So I think public health is really important, and it is one of those things that is unseen. It's just kind of going on in the background, and there's so many things that contribute to public health. So there's the obvious things out there like prevention, like what you do with tobacco cessation. There's immunizations. But I was brought up understanding that public health is also plumbing, that in some ways, sanitation is actually more important to your daily health, and making sure that the water goes away and clean drinking water comes in can be more important than a visit to the doctor. We are very lucky to live in a society where we don't have to worry about things like cholera anymore. So that's awesome.
Yeah.
And that's because of public health.
Mm-hmm.
Not what you and I do today, but It's still all inclusive there.
Yeah. Those are the things that you don't normally think about. Things like plumbing. I mean, that makes a big difference, right?
Yeah, absolutely. And within public health, there's so many different other things. For example, smoking cessation. But what about safety belts?
Mm-hmm. Yeah.
And think about back in the 80s. Oh, wait. Anyway. Back in the 80s, people were like, that was when safety belts were starting to come out, and people were like, safety belt laws. Mm-hmm. So policy is part of public health. But when we had safety belt laws, the original thing was, what are we doing here? And then another generation later, everybody's just like, yeah, safety belts.
So public safety is a big one, right? Seat belts, legislation. Do you think the general public kind of understands that? Or is that, what do you think the general outlook on something like that is?
Oh, general public's a tough topic because everybody's so different. And it's hard for me to answer that question because the nature of my job is customized public health messaging. Because public health messaging isn't a one size fits all, people are so very different. And so I think, you can't just say that you can't paint everybody with the same brush and say, this is what the general population understands about public health. I think we have all kinds of different understanding. And even if they don't call it public health, many people probably appreciate that there are seatbelt laws and guidance on how to put your kiddo into a car seat. And there are things that are part of public health that we do appreciate that we just don't call it that.
Yeah. So what is the ultimate goal of public health, do you think?
Ooh. That is a big one, huh? Well, it's basically making everybody healthier. We want to live longer, better lives, right? We want to live as long as we can with the best quality of life. Isn't that what we all want?
Yeah, so I for sure want.
Yeah, sounds good to me.
Things like policy, legislation, seatbelt laws. Are there other things that maybe we don't think about that could be fit in that public health realm?
So there's drinking water, immunizations, like we said before. Mm-hmm. A lot of times we think about upstream health. So I don't know if you've heard about this analogy.
Yeah, what is upstream health?
Okay, so upstream health is basically this analogy, the story of there's a couple people that have fallen into the river, and everybody's like, oh my gosh, we got to come help me. Let's get them and let's pull them out of the river. And they're like, And then they get this person out, and there's another person that's fallen into the river, and everybody's like panicking. Like, yeah, let's take care of this problem. This people in the river, and eventually somebody goes, "Why are there so many people falling in the river?" And they walk upstream, and they're like, "Oh, this bridge doesn't have a railing on it, or something's going on that's kicking people into the river. So let's talk about what we can do to stop them from falling into the river."
So it sounds like we're preventing these issues before they even have a chance to happen or put people at risk.
Yes, public health is a lot about prevention. That's actually one of that's the primary aspect of public health is going to be prevention. Secondary is screening, and tertiary is treatment. And those are kind of the three levels. That's getting a little academic, but we do think about things like that. You go to your doctor, you have your preventative visit, your wellness check. Hey, is everything going? Everything's good. And then they go, "Oh yeah, you're about that age. We need to screen you for blah. Maybe your colonoscopy, maybe your mammogram." That's your screening saying, "Hey, how's that going? Let's check to make sure you don't have this. If it is, then you go to that third level, that let's treat what you've got." And that's where the medical kind of portion comes in.
We talked earlier too about the impact that public health has. So when we compare public health versus, a doctor's visit, do we see a difference there, or like in the average lifespan of us humans?
Well, there's definitely differences in those things, but we are a team. So I want to make sure we say that, because we can't do anything without them. And we want them to include us and think about prevention, of course, too. There's a lot of overlap there. And, we're definitely partners. But in the grand scheme of things, in the 20th century, that time period, our lifespans increased by 30 years.
Wow, 30 years?
30 years. That's a lot.
It is a lot.
Our general lifespans. And so 25 of those years are more due to public health measures, and only about 5 of those are for medical advancements. But when you say public health, that's sanitation, that's nutrition, even job safety, not just like safety belts in cars and stuff, but job safety. All those things were a big part of that. 25 years of that chunk was, just thinking about things, making things safer and more sanitary for people.
Yeah. So it seems like both of these entities have a role. Public health plays a role, doctors play a role, providers play a role, but maybe we're a little bit more victorious.
Well, from a public perspective, yes, right? If you're looking at population health, but you also don't want to, lose sight of the tree for the forest, even though we usually say people get, forest for the trees, but each individual counts too. And so on an individual level, one individual doctor or a medical provider could make a huge difference in that individual's life. And so even though we need to be able to balance population health with an individual and keep those individuals in mind. And that's a really important part of public health.
Yeah. That's actually a great point, because individual health versus sort of this population health, it's something that I even quite don't understand fully. Do you have a better grasp on, like, what does it mean to be a doctor and to just work with an individual patient, and then to be part of public health and work out as, I don't have just one patient, right? I work in tobacco and prevention, and I work with a ton of teens and lots of youth and parents and people who want to quit smoking. But not just one of them. I work on all of them. So what's the difference between individual, health and then that population health?
Individual health is a lot of things, because there's what you are already born with. There's what you came out being healthy with. There's decisions you've made. There's behaviors you've chosen. There's behaviors that you learned as a child and growing up and just being part of our culture. If we were born on the other side of the planet, we would have a different set of learned behaviors, a different culture that leads to different health outcomes. Even if we grew up in a different state, we could have different health outcomes. And so each one of those characteristics of an individual is going to lead to the population's health as a whole.
Interesting. So kind of going back to that raft around the river, right? Let's think about how do we fix that bridge as a team and stop, lots of people from falling into the water, versus how do we help that one person who just fell out of the boat? Is that?
Yeah, exactly. Well, and there's a couple different ways to approach it, right? You can go and you might look and be like, okay, well, we need to make a law that nobody's ever allowed to cross that bridge again. And I might be like, well, let's just put up a sign.
Yeah.
We could just put up a sign and just kind of be like, hey, you shouldn't walk over there. And maybe only one person would fall in then. And is that an acceptable outcome?
Uh-huh.
And that's where the conversation really needs to start is, are we, how much public health policy are we doing? How much public health support are we doing? Are we doing public health promotion? And there's a lot of nuance in that.
Yeah, a ton of nuance. One piece in my work right now is there's a lot of talk around a flavor ban for e-cigarettes. And like your analogy, right? Do we put up a sign or do we ban it completely? A lot of people on one side of the argument say, well, we need to ban these flavors because they attract youth, and youth, before that, if it was just cigarettes, there was a big barrier to entry. Cigarettes don't taste good. You smoke them, it's like you make you cough and they hurt your throat, and it's not great. But now with these flavored cigarettes, they're much more accessible. There's less of a barrier to try. They taste good. And so the idea is, let's get rid of these flavors, and we'll therefore not attract youth to these harmful products. But then the opposition to that, these retailers say, well, they help adults quit smoking. You need flavors for that. Whether that's true or not, is to be, decided. But that's the kind of idea that we have to have these conversations. And there's always people on the other side who say, that's not good, or I don't want that. So
it is incredibly difficult. And I think it's important to look at not just where both sides are coming from, but there's multiple different angles and stuff there. You've got your retailers, you've got the people who truly do want people to stop smoking. There's people who that has been successful for, but there's also the knowledge. There's a knowledge gap there right now. And that's one of the painful parts about being in public health is that it takes 10 to 15 years from the beginning of a study to this is actual practice. And so how long has vaping been around?
Since like around 2000, 2006, somewhere in there.
And where are we at on studies?
Yeah, I mean, there's a few, right?
Yeah.
Not enough data to be conclusive about anything, or what are the effects long term. We don't know. They haven't been around long enough.
Right. We might know a lot about short term, but we don't know about, there is no 20-year vapor yet, or just barely. We've got those people who have been vaping that whole time. And so that's the great thing about public health, though, is we grow, we change, and we continue to learn more, and we roll with the punches.
This is a great conversation about policy and how studies change things and move the needle on our health as a society. You do a lot of work with educating providers and updates. What does that work look like for you?
So that's my favorite part of my job. I love that part because I get to go out and, in a way, I am what I wish I had when I worked in a medical office, because the nature of medical care is you're busy. You're seeing a ton of people. You want to do the best you can for them. There's all this other stuff going on. And so you get kind of tunnel vision. It's nature of the beast. And honestly, the best healthcare workers do that. They hunker down, they focus in, and they get their jobs done. But it's hard to learn new things then about, for example, like what resources are available in town, or if there are how many pharmacies are still open. Did Rite Aid close? Oh wait, what was it? Weimar? Where do we send people now? And there's just these little things that I am absolutely confident that every single one of these people can figure out on their own. But I just want to make it easier for them.
Yeah.
And so I show up and I have conversations with them. A big part of the beginning of the conversation is kind of an assessment, a mini assessment, where I say, hey, what's going on? What's going on in your life? What are the obstacles that you're seeing to care in Douglas County? And can I help? And we have great conversations about that. And one of my favorite tools that I use was actually from a single 5-second conversation with a medical assistant that said, hey, where do I send somebody to get a Hep B vaccination? I was like, you know what? I don't know. And I'm going to find out. And it spawned into this huge flyer that says where everybody can get all the different vaccines that we now update all the time, and has inspired us to do more with that. And it's become a really great tool. And it started with a simple conversation and a simple question that wouldn't have been asked if I wasn't there. Yeah. Not that I'm special, but the role is that one-on-one communication is special. That feedback and getting the answers instead of just pushing information out and expecting it to be consumed the same way by every single person.
So it sounds like providers are busy people, right? They're doctors. They're constantly and they specialize in one thing, right? And that's to help their patient and have their patient hopefully excel. And there's all these little things that can improve the health of the patient that they could find out, but they're so inundated with all these things that it would be nice if all that information was just in one place. And is that something you go and collect all those little pieces and then go, here you go, here's like everything you need in a simple, easy to find format?
And I often tell them, think of me as local Google. And you kind of begs the question, well, don't you just Google it? Dude, have you ever tried to Google healthcare?
Yeah.
There's all these sponsored links, and then there's these advertisements for, oh, you're going to go to this pharmacy, that pharmacy. It gets cumbersome, and so I just try to filter that down and really make it very direct and make it something that's easy to communicate with patients and with partners so that people can just get the care that they need or get the resources that they need. Oh, and keep it updated because things change. So
constantly, right? They're constantly changing. We have new resources in the community and then resources that maybe lose funding or aren't available. And so you're still referring to this patient to this thing that doesn't exist. I can't imagine how the patient must feel going to this thing. It's like, this class doesn't exist anymore. I can't do this thing that's supposed to help me.
Yeah, exactly. And it would be really nice if we were able to give patients choices as well. I think that sometimes we find a favorite when we're in the office. We're like, oh, this worked. Just go here. But that might not fit that patient, their schedule. Maybe they need virtual. Maybe they need texting. Maybe there's a lot of different things that they may need. And so having the options for the variety of patients that we do have is nice.
And in Douglas County, we live in a very rural community. And one of the pressing issues we have is getting docs, getting local providers to come to Douglas County and stay in Douglas County. And it seems like you're playing this role of, well, we're having a really tough time getting these providers, but here's one way that we can help. Here's one way that public health can help. Let's make your job as provider much easier so you can take on more patients so that your patients have better outcomes because they have all these resources readily available.
It's not an active goal of mine, but if in any way my job positively influences doctors to feel more comfortable and stay in this community, I'd be stoked. Yeah.
And you actually worked in healthcare, in direct healthcare for a while, right?
Yep. I actually started in medical offices when I was 14, I think, just filing real charts. That's back when there were actual real charts. And, full disclosure, my mom's a physician and I worked for her. But I kind of learned something back then too. We both did, in that we had conversations that didn't usually happen. The doctor doesn't talk to the file clerk. That's just not normal. That's not a common occurrence. But we would talk about stuff and she would entertain my process endeavors.
Yeah.
And we redid certain processes in the office because of those conversations. And I think that is somewhat foundational in where I headed, in that I feel like if you get everybody together and really talk about what could we do to make this better, there's small changes that can be made. It's just not everybody always has those conversations.
I remember, even going to the doctor for me is just such a pain, right? You have to go there and there's all these things and you're going to be there for hours and hours. And it seems like we had conversations earlier where you and your mom talked, or the physician talked with, and made small improvements to make these visits really pleasant for patients.
We did, and I don't know if we're unique in that, because I know my own doctor, I can get in same day. I get seen pretty promptly. And I know that there are certain providers and specialists that's just not the nature of the way their practice is going to work. But it was something we wanted to be mindful of. And we wanted to be mindful of everybody else's time. And we tried really hard to stay on schedule all the time and make sure that everything was as comfortable for everyone as possible. It was we didn't call it a patient-centered model, but I guess it was.
Yeah. I mean, really, it is a patient-centered model, right? And yeah.
We had some freedom to do that. and I don't know, I guess I don't really know what I mean by that. I think part of it was definitely a priority. Um, and we structured everything around that. Basically, it was the schedule that drove everything.
When you're talking with docs, one of the things that you do that's really important is provide them with new updates about what's going on in the community. And I don't know what the most recent one was. Was that xylazine?
So xylazine was one we started last year and has been ongoing. It's definitely a complicated topic, but one of the ones I'm most proud of and really excited about is kind of simple, but it's about concussion. It's something pretty easy, but my position and our unique environment allowed this to happen. So the background is we partnered with Douglas Education Service District, which is the district that helps all the schools in the area by supporting them. And they had an initiative to make sure that there were forms that were filled out if a student had a concussion, so that they would know how to accommodate that student. This is simple,
Yeah,
right? It's just
yeah.
a form. But how do you get doctors to start using this new form?
Mm.
And how did the school nurses and the ESD nurses talk to every single doctor in town?
Right.
And so they heard about what we were doing, and they came to me, and we talked about it, and we decided to take it on as an initiative. And so I can go out now and deliver this information, talk to them about the forms, and get feedback and let the nurses know. And so it's this big two-way street. And my favorite little tag along on the story is that I was like, well, but how do the forms get turned in? And it was like, that's a process thing, because I still like medical brain. I'm in my medical office. I'm like, well, how would I do this? How would I turn this in? And so we decided that, it should go with the parents, and we should also fax it in. And so on my first visit, I was able to show up with a fax list, and that was super cool.
Amazing.
And so I really like that story, even though it's a very, very simple thing. But it was a state initiative, and I'm really hoping that a lot of the offices know what that is now, and we get kiddos back to school as quickly as possible and accommodated when they need it. And so they can have the best outcomes if they do happen to have a traumatic brain injury.
Hey, it's Mitchell here. I just wanted to take a brief moment to talk about our DC Smoke-Free campaign. We are tackling the impact of nicotine products in our community by providing resources and support to help folks quit and stay free from nicotine. We're also constantly adding new materials to our website, like blog posts, articles, videos, and more. So make sure to check back periodically for fresh resources. Visit DCsmokeFree.com to join our movement and explore everything we have to offer. Okay, back to the podcast. So Kendra, I hear that you are a certified health education specialist.
Correct.
What is that?
So it basically, after I got my master's in public health, there are some areas of responsibility there that coincide with becoming a health educator. There are many people who are health educators, but there is a specific certification where you got to sit for a test and all that kind of stuff to have the initials behind your name. And I discussed that with some of my, professional friends and leadership here, and I felt like it was something I wanted to go after. And there's also a couple other people in the community who have those similar initials, or they have the extra special ones, and those were mentors of mine. And so I was really inspired to go after that. I love the health education part because it looks at health education a little differently than medical offices do. There's a couple different models that think about health behaviors, health decisions, and different ways of looking about why people do what they do. Why do people start vaping?
Right.
Why is it hard to quit? I think when you say, oh, well, you're in the doctor's office and they're like, okay, you should quit smoking.
So helpful.
And that's great. And that may be all they've got time for that day. And I have absolute empathy with the docs on, well, that's not the only thing they're telling you to quit or telling you to do, or it's like, okay, we're going to start this medication. You need to know what the side effects are. We're going to do this thing. We're going to order this test. There's a ton of information. And by the way, you should also stop smoking. You've heard it before. You know that, but what goes into that? And I guess I started really wanting to understand, why do people make the health decisions that they make? And so I really wanted to delve into that. And that's why I studied that more and went for the certification.
How long did that take? Just out of my own curiosity.
Oh, the studying? It took a couple months of studying, and then I sat for a test one day. That test was intense. It was a proctored test I did at home and all this stuff, and they watch you, and it's very, very intense test to take. It was a couple hours long, and then it took a long time to get the results back. Um, but basically everything that was on the test, a lot of it was stuff I learned in my degree work, but I just had to study specific things more closely. So.
Very cool.
So some of those things that we studied are health behavior models that comes into the motivational interviewing that you were talking about before. And one of them is pretty simple, and it's the stages of change model.
Oh, yeah.
And it really applies really well to smoking cessation. Basically, it almost seems like it's an intuitive way to look at stuff, but it's nice that there's a model that explains these things. And so it starts with the idea that if you're going to consider stopping smoking or several different types of health behaviors, you start thinking about it first. You're just like, I really should do that. And then the next step would be, all right, well, how do I do these things? Like, do I get on a patch? Do I take a class? What do I want to do? And that's where you're really in this contemplation stage. You're really thinking about it. And then you get to this determination. You're like, all right, I'm going to do this. I have a plan on this date. I'm going to quit, or I'm going to cut back by this much or whatever. And then on this date, you take an action. And then you just do, right? No. So what I really like about this model is it shows that it's a cycle. You start taking this action, like say over summer, I started walking more. It was great. And now it started raining. So I have to go back into contemplation and maybe replan. Okay, I need to make sure I have an umbrella. I need to make sure I do this. Same thing with smoking or other health behaviors. You do this whole cycle where you can drop out and then pop back in. And so it's a nice way to think about it. And it's also a nice way to gauge where someone's at. And I think that a really big part of health behavior is meeting someone where they're at. So assuming that everyone who needs to stop smoking is at determination,
Right.
It's important to ask them some questions about where are you at? Are they even really thinking about it? Are they contemplating? Are they determined? Or did they quit last week and they just need some help in sustaining that new behavior? So that's one of the things I like about it.
So there's a crazy fact about tobacco is that it's something like, maybe this isn't quite right, but it's like more than 65 or 70% of people who smoke have a desire to quit. They want to quit. They know it's harmful for them and they want to stop. But when people who take a class who are actively trying to quit, less than 5% of them actually do. So a lot of people express the desire to do it, but the success rates just aren't there.
Yeah. And so I think that looking at those reasons why is a really important thing. So there's another model that kind of plays in to smoking cessation. It's a little more apt for other ones, but it's the health belief model. And it's kind of like, I like it because it talks about the person's perceptions of their situation. And so one of it is like the perceived severity. How bad is smoking? I think people know smoking's bad, but I think this is one of those things where vaping maybe, what's the perceived severity of the problem? What are the perceived benefits of quitting? Like, are there actually benefits? What are the barriers? That's another really good one. And then self-efficacy. And I think we could have a whole series of a podcast on self-efficacy.
What does self-efficacy mean? Like, what is that?
Self-efficacy, I'm going to actually quote from the health belief model and it says, this refers to the level of a person's confidence in their ability to successfully perform a behavior. So self-efficacy means I can do this, I can make this change, or I can't do that. And I think we all have different levels of self-efficacy for different things.
Can I make dinner? Or
right.
Can I go to the store?
I change a tire?
Yeah. Right.
And some of that has to do with my belief system around what I'm capable of doing, and some of that's based on reality, my own experience, right? So these things start to get pretty complicated.
Yeah. Interesting. And then there's like another topic here that I kind of want to just bring up just briefly, but there's a lot of these self-help gurus on YouTube or, whatever that's like, just take a cold shower and you can do literally anything you want, or take an ice bath for 5 minutes and you can now, make all these crazy claims like you can fly. That's not quite right, but you have
Yeah.
better focus and better health. How does that fit into maybe this model or the self-efficacy? I mean, if we're telling people just do this and everything is way better, does that change their self-efficacy about things if you really believe some of those false claims?
It might for some people, but humans are so much more complicated than that. And humans' lives are so much more complicated than that. And an individual human's life could be great one day and that'll work for them, and next year it doesn't. These things need to be revisited, they need to be reviewed, and we all need to keep honing our own health behaviors to see how this works for us. Like something that was easy last year suddenly isn't. And something that was really hard last year, I can do that now. So it's a very complicated model. Humans are complex creatures. The oversimplification of a solution is usually not a thing.
Things are way more nuanced and complicated than we like to think or perceive.
It'd be great if there was just like an easy solution to everything.
Right.
It'd be fantastic. If we could wave that magic wand, that'd be great.
Yeah.
It's not like that. And I mean, even I'm sitting here saying that these health belief models are a great way to look at things. They're not the only way. There's also other nuanced ways to look at these things. But I guess my argument is the simplicity of we need to stop smoking or we need to stop vaping. It's never that simple. We need to look at the whole person, their whole belief system, where they're at and what their obstacles are to help them to what they want to do. There's also the autonomy piece.
Yeah. So I do some of these quit groups. I go and join the quit classes and, provide some feedback and advice from the public health level. And we constantly revisit actually the health belief model. Surprisingly, and I didn't think about this before, but we really do. So we have one member who truly believes that if you are determined enough to quit, then you can do it. If you have that determination, you absolutely can do it. And we have other members in the group who say, well, I'm determined to do it, but it's really hard because of, X, Y, Z. It's really hard because I have no free time. It's really hard because all my friends are smokers, and it's a lot about the obstacles they need to get through or overcome. And if they could just do that, then they could be successful.
Right.
And this member says, no, it doesn't matter about any of that. If you're determined, you can do it. So I think people, feel differently about how to go about some of these things, and maybe there is no right answer. I don't know.
I don't think there is a right answer. Some people have a tremendous amount of willpower, and I bonus for that. I don't.
Yeah.
Maybe I do on certain things, but a lot of that's probably also based in other complex belief systems and cultural norms and where you're from and the support systems you have. The people we're around are a huge piece of willpower.
Yeah.
I mean, whether or not we pick up something from the grocery store is a little piece easier willpower than when it's sitting on the shelf at home. There's places where you can have willpower. I mean, not buying the cigarettes is probably the first step. Not opening the cigarettes is the next step. Not putting the cigarette in your mouth, maybe the next step. When can you have the willpower? But when someone's sitting next to you, you don't have control over whether or not that person lights up. And your willpower is definitely challenged more. So I guess all that to say that willpower is a piece of it. I think that's another way to say self-efficacy and determination. But I strongly feel that there's a lot more to it than that. Humans are complex creatures. They deserve to be seen that way.
Yeah, absolutely. I read this book once that I think it was called Atomic Habits, and the sort of foundation or the basis of this was it was his take on probably the behavior health model, and the idea was if you change your belief of who you are, so if I say I'm a public health leader, then I'll act in accordance with that belief, and I'll make actions in that manner. So if I believe I'm not a smoker, well, I'm not going to go to the store and buy cigarettes. I'm not going to be around people who vape, and my actions are going to go in accordance with that belief. And for me, that kind of resonated with me, and I think I've made some better life choices. Or I went to the gym more. I did this because I'm a fit person. That's my belief, and I want to work out. But But I don't. But for some people, I've seen, hey, try this thing. It really worked for me. It was helpful. They didn't resonate with them, and it wasn't their thing. So I think, is that just another example of there's no one size fits all, and all these self-help books are great, but they're just slightly different perspectives on that may help some people but not others.
Absolutely. So, especially with the whole, hey, this worked for me, but that doesn't mean it's going to work for the other person. I think one of the keys to helping people figure out what's next for them is that menu of options and having a lot of different choices to see how this is going to fit into their life. Um, because just because it worked for one person one way doesn't mean it's going to work for somebody else. There's a lot of different reasons why.
Yeah. So if you're a friend out there or provider and you want to help someone else, is there other things that we can do to help them or motivate them in some way?
I think being supportive is the biggest thing, and that every little bit helps. A mentor, well, not a mentor, someone I look up to in the world once said, just keep quitting smoking. So, you fail sometimes, and I don't smoke, but I think about it in terms of exercise.
Yeah.
And I struggle with time management to be able to make that. And I used to get very down on myself for, oh, I didn't work out this many times this week.
Mm-hmm.
And then I heard that voice in my head just saying, just keep doing it.
Mhm.
Like, yeah, you failed this week and you didn't work out even once. Or maybe you failed this week and you lit up a cigarette. Quit again,
Yeah.
work out again, just keep going. That there's this setting realistic goals is a big piece of health behaviors, and also rewarding yourself for what steps you took towards this goal. I think the willpower thing is like, if you're going to quit, you will, and then everything's fine. It's a growth process. You got to take this step, next step, whatever. And as for friends, family, and people who want to help out, help that person recognize what their next step is and celebrate when they get to that next step. Not just the goal. Quitting smoking is great. Quitting vaping is great. But cutting back should be celebrated.
I shout out DCsmokeFree, but I wrote this article a while back ago, maybe last year, about the power of failure and how failure can actually be a really good thing.
Yeah.
And you need to fail in order to learn more about what not to do and how to push forward. So it seems like failure can be good and celebrated sometimes, right? You don't want to fail continuously, but you learn from that and you can grow and in the pursuit of a better health behavior or a better mindset or whatever it is you're trying to pursue.
Yeah. Failure is just an opportunity for growth.
You also do motivational interviewing training. What is that?
So, all right, let me see if I can do this justice. Motivational interviewing is
Can we do the exercise that we did at one point? Like,
yes.
let's just start. We want to start with that, and then with no context, or do you want?
Sure, why not?
Cool.
Okay, if the know one thing about me.
Yeah.
Okay.
So we're gonna do a thing about what this is an aspect of motivational interviewing, right?
Yeah, it's an exercise you can do to work on a specific technique in motivational interviewing.
Okay, so we're gonna try this thing, and you're gonna have no context about what this is, but I think it'll be fun.
Okay, so I'm gonna start with, if you know one thing about me, I'm gonna tell you what that is, and then you're going to tell me something back and say, do you mean this? Do you mean that? And all I get to say is yes or no, and then we're gonna go again, and you're gonna try to dig deeper into what am I talking about? What do I mean by that? So the point is to get to the deeper meaning.
Okay.
All right. So I got to pick a trait. Let's go for it. So if there's one thing you should know about me, I am outspoken.
Outspoken. Okay. Does that mean you are energetic?
No.
Okay. Does that mean you are a very social person?
Yes.
Does that mean you're rude?
No.
Does that mean you don't care about other people?
No.
Does that mean you fight for what you believe in?
Yes.
Does that mean you're passionate?
Yes.
Does that mean you're mouthy?
Maybe. So do you see how, I mean, we kind of came up with sort of synonyms for outspoken, but they weren't really synonyms, but you were driving down to like, what is that deeper meaning? And some of the times you weren't on the right path and some of the times you were. And I think that's really, this exercise really shows how one word and what it means to me about me might be interpreted very differently by even somebody who knows me pretty well.
Yeah.
And so that's really how this exercise goes. It's appreciating that sometimes when you're listening to someone, what you hear needs to be reflected back to them so you can kind of do a self-check on your perception. And that's one of the key tenets of motivational interviewing is reflecting what you just heard. That's also used in just active listening. But motivational interviewing is a little more three-dimensional chess than that. But that is one aspect, and it's one of my favorite aspects as a not someone who was naturally good at active listening. So I like to use that practice. So the rest of motivational interviewing, it's utilized in a lot of different health behaviors, specifically to get behavior change. It's pretty popularly used in behavioral health for substance use disorder, but it's also incredibly successful for helping with medication adherence with patients, because when you offer a patient a new medication and they just kind of nod, and then they don't pick it up.
Right.
Why? What's going on? Finding out, what their situation is. Is it the insurance? Is it there was an interaction? Is it they took something similar before, but they didn't tell you about that? So motivational interviewing helps drive that deeper meaning and get some more information from that patient. Okay, so the spirit of MI is really summarized in the word CAPE, so CAPE, and that's compassion, acceptance, partnership, and evocation. So it's not just listening and hearing, but actually evoking from that other person, what are we going to do? What's that behavior change look like for you?
Yeah.
In a compassionate and accepting way, and really focusing on that person's autonomy. So that's one of the spirits of MI.
So personally, I guess I set this up for sure because I took a class on MI with Kendra and I absolutely loved it. Like it was life-changing for me, especially when we talk about active listening, and not just for the people that I work with within my role here in public health, but in my daily life. I really feel that I'm a better communicator than I was. I'm able to listen to others with intent and
Same.
understanding. And in fact, just the other day, I was thinking, man, my skills are really kind of rusty. I feel like I should take another class or a refresher on this. And I really found it quite valuable. Why? I mean, why? Why is it so great? Like, what makes...
Oh, that's interesting. So, I mean, I think I could only really speak for me, and maybe some of it's the same. And quick aside, full disclosure, we contract with a trainer named Dr. Kathleen Northrop Snyder, and she is a Mint certified trainer. So she's actually been trained professionally and has a PhD not in motivational interviewing, but she's a public health nurse by practice. So she has this great background, and I think she really brings some great information to her motivational interviewing training that I get to be a mentor for. So super stoked about that. But I think communication for me, it really helped. For me, it was reflections a lot, and that I consider myself a pretty intuitive person.
We should they probably don't know what reflections are.
Oh, okay. So, reflections are what we were doing earlier, that little reflection exercise where you're saying, is it this? Is it that? You're saying back to me what you think I mean in a way that I can go, yeah, no, I mean this. And in doing so, you're doing that self-check. For me, that was important because I consider myself pretty intuitive. I think I know what people are thinking. A lot of the time, I'm pretty successful with that.
Yeah.
Because I'm mouthy, right? I'm outspoken. I like to talk to people. I like communicating. It's a strength I have. But I'm not always right. I'm right a lot, but I need to check in. It's really important to check in. And it's really important to check in with people you know really well, actually, because you're more likely to make those assumptions. I think with strangers, it's a little easier to go, oh, I need to check myself. But It's important to bake those into your conversations so that you are on the same page with somebody before you get into a deeper conversation. Because where are you going?
Right.
Like, you're going where you think you're going. They're like, that's not where we were going. So that's a big aspect of motivational interviewing. And I think it just helps get you in that partnership level with whomever you're speaking with. You're on the same page from the get-go with motivational interviewing.
Do you have an experience where reflections were particularly helpful for you, with whether it was in public health role or your personal life?
Oh gosh, yes. So not to get too specific, but we were building a thing this summer, and our visions were very different. So I'm going to say a family member. But the visions were very different, and we weren't speaking the same English. I don't know what was happening. And I think sometimes it's just like you can be so much on the same page with one person on so many different things, but then you get down to a skill that we don't use those English words on a day-to-day basis.
Mhm.
You're doing something that's outside of your wheelhouse.
Yeah.
And so we're both trying to express what we were envisioning, and it wasn't coming out right. And so I was like, okay, I got to tap into my MI. And so I was like, do you mean this? What is this? And so I went backwards with that instead of just charging forward with, this is my vision. I was like, is this what you're saying?
Yeah.
And honestly, you know what? There's a couple of people I know that are coworkers of ours that do this naturally.
Mm.
I know we don't. And that's okay. There's all sorts of different communicators in the world, and that's perfectly fine. But there are some people who kind of naturally reflect, and it's really beautiful. So they're good at MI on the basics, right?
Mhm.
But MI really also starts to look into, where does this person want to head with this health behavior? It's kind of like going to the park and seeing a bunch of different paths and saying, all right, we're going to get to the other side of the park,
Yeah.
but there's a lot of different paths we can go down. What does that one look like for you?
Mhm.
And you want to listen to them, and then you start going down that path with them, but your expertise comes in because you're like, I've been down that path before, or I know people who have been down that path before. These are the obstacles we're going to find. Can we talk about those? Let's help you prepare for what that path's going to look like for you. And that's where behavior change is really helpful, because you can say, you want to go to the smoke-free pregnancy class. That's something you want to do. We've determined that. Other people have had trouble with transportation. How's that? Other people have had trouble making it every time. Are you okay with missing classes? What about making it? I don't know, that sort of thing. And so you can just walk through all those things. It's really beautiful in that way.
Yeah. Because just like for the smoke-free pregnancy class, we provide incentives. There's a lot of motivation and drive to get to those classes.
Mm-hmm.
But if transportation is an issue, they just can't get there. Well, we need to address that. And you
Right.
would never know unless you ask or talk about that, whether they feel embarrassed or what it is, whatever it is, right? There's a reason they can't get there, but you have to ask those questions.
Right.
You have to dig a little deeper and find out the root cause of why can't they make it? But it's like that for any sort of health behavior promotion, right? There's some root cause or barriers preventing them from seeking that care or that wellness class or whatever it is.
Well, one of the things we talk about in MI class is finding that powerful question, right? So not just, can you get transportation? That's really, it's close-ended.
Right.
It's a closed-ended question. And there's open is, how do you see yourself getting there, or what does that look like for you? But sometimes it's asking something even more open, like, what has been your experience
Mm-hmm.
with attending classes in the past?
Mm.
And now it's not just about transportation. I went and I really didn't like the people there. I went and I didn't feel like I was a part of. I went and it just didn't do me any good. Like, they're going to tell you a story, maybe,
Mhm.
especially if you get that partnership going. They're going to tell you that story. And then now you've got a whole new obstacle you didn't know existed. And now you can work with that.
Yeah.
And so MI is really about creating those powerful questions that dive deeper than just what we expect to find in obstacles.
Yeah.
And that's why it's hard.
It's very hard.
And you got to keep practicing.
You talked about asking open-ended questions.
Mhm.
Is that, for me personally, I don't process things like everyone else, I guess, or not everyone else, but I process things very uniquely. If I can just solve a problem, I don't have to process it. I don't have to feel that emotion. I can just, I fixed
Oh.
it, right? But I've been having lots of practice with you and other people asking me these open-ended questions about this challenge in life that I'm facing.
Mhm.
And it makes me process the information and think about it and then actually answer what's going on. And that has been extraordinarily helpful for me in even my own personal life. Just being able to think about all this information, think about the question, and then having to process that, think things through. Because
Yeah.
I don't think, and a lot of us are guilty of not processing all the things. We just go, boom, here's information, boom, here's a solution. It's point A, point B, but we haven't considered the other options or.
No, I think you've really, nailed something down, which is that, again, we're complex human beings. We're all very complicated. But you, like me, we're like, well, let's get the data, let's do the logical thing, and we'll just make a decision. But data isn't the only way we make decisions in our lives, even though I wish information made all the decisions all the time, right? But we have a value system, we have belief systems, and we have other things that are important to us. And we are so much more complicated than just what is logical for us and what is best and what's a cost-benefit analysis. We have values, and that should play into our decisions because it gives us a deeper meaning in every decision that we make.
So we are promoting motivational interviewing within Douglas County. Is that right?
Correct.
And for
So
health.
we're creating a motivational interviewing learning community. So we have multiple different ways to access motivational interviewing trainings. We do in-person, we do virtual, we do Motivational Mondays where we do some mentorship. There's even one-on-one mentoring. And we hope that it grows. We hope that just like with all health behaviors, we find out what people need and we can turn it into a better learning community. So yeah, all these things are growing all the time for our partners and for our clinical partners so that they can tap into this skill. And many of them are already incredibly talented motivational interviewing. They have great technique. But you get out of practice and you need that refresher. And so we love doing that. We love having refreshers. We love having people come back. We got one person who says, I show up once a year because I just want to get my foundations back again. And so we've had so many partners from so many different aspects of the community. And I really love that it's being introduced to non-traditional motivational interviewing users, people who are helping people find jobs. That's cool. Like most of the time it's used for these more medical things, behavioral health, but it works there too.
Yeah. I found it very valuable in my life because I do fall out of practice, I've noticed.
Mhm.
I go from, I take a class, I train, I practice these skills, and then I go into my personal life and I use a lot of these techniques, asking open-ended questions. And then, over time, I slowly shift back into the role of just solving problems.
Mhm.
Someone comes to me, here's the thing, just do this, just do that. When, oftentimes they're not looking for the solution to the problem. They just want to be heard, or they want to, they just want to tell you about their experience. And I think that's totally fine. We should do that more of that.
Absolutely. Yeah. I think I've seen memes on the internet and stuff where it's like, before you start any conversation with somebody, it's like, okay, are we venting or are we solving? And there's room for both. Totally. And sometimes vent turns into, okay, I'm ready to solve. And just because someone is venting today doesn't mean they're not going to be ready to try to solve tomorrow. But I think knowing what role you're supposed to play today is pretty important. And motivational interviewing will pretty much always get you to what you need to be at because you're listening to what they want. So, and it does it. And it also kind of helps that person think it through. Even if they were venting, if you're doing some really good reflections and really powerful observations, especially if you know the person well, it might turn into a solution session.
Right. Certainly thrilled to have Kendra on today. I, want to get into what inspired you to get into public health. What was your motivation for that?
Oh, okay. So actually, funny story. Like I said, grew up in medical clinics and continued down that line, worked in several different areas and got some nice opportunities to work with many different specialties, which I loved. And then at some point, life changes happen and I was like, maybe I should go back to school. And this was actually about 10 years ago and it was expensive then and I chose not to. But I was like, what would I go back to school for? I originally started my bachelor's fresh out of high school and went into cultural anthropology, which I loved.
Yeah.
Anthropology is super exciting. It's, anyways. But I had this strength in medical, and I loved medical and helping people, right? Anthropology is more study, not that much helping. I realized I loved helping. And so I wanted to do more of that. I was like, oh, I should go into medical anthropology. Apparently that's called public health, and I didn't know that because public health really is about why are people doing what they're doing as a whole in an area, whatever that population is. It could be a school, it could be a county, it could be a nation, it could be the world. And so I basically fumbled into public health. My doctor retired, and I decided to go back to school, finish up my bachelor's. And then this thing happened at COVID. Do you remember that?
I think I remember a little bit
All
of
right,
that.
cool. So I didn't know what to do, and I was looking for a job, had gone to the employment office, and one day they called me and they're like, hey, there's this contact tracing job. And I had applied for a couple of those national ones, right? And I was like, oh, okay, cool. And I went in and got the interview, and they hired me to be part of the COVID team. And it was my first experience with anything really public health related. It felt a little bit more medical because we were taking care of individuals in our contact tracing and case investigation. So it felt comfortable, but I still liked the goals, and I loved the people, and I loved what we were doing, and we were able to help in ways that I didn't feel I always could in a medical office, because we could say, hey, you need to stay home. And people would say, I can't because, and I'd say, hey, I can help with that. And I never got to say, hey, I can help with that in an office. And that felt super good. So I think that's where there was a little bit of a spark there for me. But long story short, I went back and got a master's, and now I do this. But one of the things that's always driven me in everything that I do is that there's a better way to address something. That whole upstream thing that we were talking about before is that within health, you can treat someone, but if they're not going home to a safe situation or a house with plumbing, and not everybody has plumbing, by the way, or they might not have electricity this week. There are still circumstances that people go through that aren't promoting health in their life. If they don't have those things, then they're not going to be healthy. And so I always kind of tried to look at those deeper meanings and those deeper things that were going on with some of our patients. And then I found out that there's this thing called the health impact pyramid, and somebody else had put it into practice. And so this had been something I'd been thinking about, how what actually supports health. And so the health impact pyramid starts with some foundational factors, which is the biggest part of the pyramid, saying that our socioeconomic factors are really the biggest supporter of health. And the next is changing the context for somebody. Remember those seatbelt laws that we were talking about?
Yeah.
That changes the context for people. The next thing up, long-lasting protective interventions. So things like colonoscopies, that screening, and then we just keep going up. And actually, clinical interventions is kind of high up there, which is where I was. I was high up on the pyramid. I wasn't doing this foundational stuff that I felt driven to do. And the funny thing is, I actually do a lot of education. Technically, education is at the very top with least impact.
Yeah.
Not saying that there's any more value in any one of these things, but we should understand when we make an effort what type of impact we can expect to have. And counseling isn't extremely impactful for someone, but changing their situation and their context can be a lot more impactful for their overall health. And that's one of the things I really liked, and how basically I wanted to move upstream.
Yeah. More upstream care.
More upstream care.
When was the first time you saw a pyramid like this before?
Basically Public Health 101 of my beginning of my grad school. And I was like, oh, somebody drew that? That's because I've always felt that education was like the key to everything, right? If you could do these things, if you educated people on a basic level, which I still feel very strongly that education is important.
Yeah.
But as we know with children in schools, if they don't have a full tummy, it's a lot harder to learn. And that's probably true for the rest of us.
Absolutely. If I don't get my lunch, oh my goodness.
Get a little hangry,
Yeah.
can't learn anything, can't function.
Can't learn, can't function, nothing.
And so that's where that, your socioeconomic factors are going to matter a lot more than just giving somebody the education and the knowledge that they need. So upstream health.
Upstream health. What are some things on this pyramid they should be looking at or considering if they want to improve, the public health outcomes in their neck of the woods?
I think it's important to look at what's going on in our communities, right? There's a lot of different partners that we have, and we can choose to support the partners that are doing the more upstream health, if that's what we want to focus on, and everybody focuses on different things. So some of that may be something like improving our playgrounds, improving walkability, improving I'm gonna shamelessly do a plug for our partners, Thrive Umpqua. They do a lot of upstream health where they do these wellness things where you can go and do cleanups or walks together.
Yeah.
And basically supporting those by joining in, join the wellness activities, join walks, join community initiatives to do things. Isn't there one coming up?
There is, yeah. Shamelessly plugged the Walkout on Tobacco, October 26th. Check that out. We're walking 450 miles for the 450 lives lost in Douglas County due to tobacco.
Yeah, so that's an important one. There's all kinds of different community events. It's one of the things I love about living in Douglas County is that we really do come together as a community, even if we have a lot of different backgrounds, maybe even some differences of opinion of how exactly to address these health concerns. We all agree that community is important. And so I think we can make that impact with getting involved in our community and supporting the things that we care about.
I think that's all the time we have today, but I really want to give a big thank you to Kendra. Thank you for being on the podcast. Your insights were invaluable, and it's always fun to have you hang out with me. So
thanks. It was great.
Awesome. Hopefully we'll see you again sometime.